Well, I first visited El Hospital de la Familia in 1999, and it was during a visit here in El Paso. And I had the opportunity to meet a longtime friend, Guadalupe de la Vega. And in fact, our families have known each other for over 3 generations. And as a pediatric surgeon, she invited me to go to the hospital and have an opportunity to visit the patients, the neonatal unit, to meet with nurses and the surgeons, and to make rounds on the wards. And I must admit, I've never forgotten that moment. It lives in my mind like it just happened yesterday, because it was really a sense of great joy to see a hospital like this serving the great needs of the very poor in Juarez. Well, I think it's a national model in respect of being able to provide outstanding health care for extremely low costs. And again, a part of that is the fact, of the unique mission, of the understanding of how to be able to work with such a vulnerable population, where you, in fact, you give them self-esteem and they provide what they can to afford their health care. And in many cases, it's not much. But in some cases, even giving 50 cents or $1 a week, maybe $1 a month, still, again, it's leveraging all those resources in addition to the FEMAP Foundation that allows that unique facility to be able to provide outstanding health care at the lowest costs. And at the same time, it's been able to attract physicians from, I would say, all over the world to be able to see this unique model. And to me, it's had just an everlasting impact on my life. And in fact, during my last visit, I kind of wanted to quit administration and go right back, to be able to take care of patients because of, just this great joy that one experienced when you walked into the halls of that beautiful hospital. The other thing that struck me about, the wonderful hospital is that, despite, the hospital being built, from just, the very basic infrastructure, there was a touch of art and a touch of poetry, and a touch of literature that was being instilled into all the patients, which again, I think, again, demonstrated the profound respect that the healthcare providers had for their patients. And again, that's where the humanities and the arts and the practice of medicine all come together. And I think it's a part of the healing process as well. Well, the impact that it had on me was, again, the very importance of giving back to your community. And so the nursing staff and the physicians and the administrative leadership was really focused on giving outstanding health care to one of the most vulnerable populations along the Texas-Mexico border region. And also to understand how important that health care was also in providing self-esteem to the patients, to be able to also inculcate the importance of preventive medicine through allowing some of those patients to become the promotoras, basically the individuals in their community to promote good health. And then also to be able to provide vocations, again, allowing empowerment to many of the women and to many of the children in El Hospital de la Familia. And again, how important that is for such a vulnerable population. Well, I think the training aspect or the educational component of El Hospital de la Familia is still, very closely aligned with the method of learning under a mentor. And so again, the role of the physician or the nurse with a young student is still a critically important part of making certain that the next generation of healthcare providers are instilled with a love of giving back to their community and to be able to provide service in a hospital like El Hospital de la Familia. I think the one aspect that I found really unique, at least during my visit to this beautiful hospital, is the fact that it also attracts nurses and physicians and public health experts from around the country, from around the world, to basically learn from this model, and also provide educational venues for the students who are receiving their medical education at El Hospital de la Familia. So not only are they exposed to a mentor within the hospital, this unique model attracts outstanding experts from around the world to also educate these students. And so these students are also exposed, to national leaders in healthcare, not only in the United States and Mexico, but in the world. And again, what a unique environment. And it's done so, in a beautiful way, and also in the teachings, not only teach the science of medicine, but also teach the art of medicine, which is really practiced at the bedside. And again, understanding how important the healing hand is, the relationship between healthcare provider and the patient, placing a stethoscope and listening to the airways of a patient and spending the time, that's a part of the educational experience and a part that is so important to the healthcare of our nation in making sure that the relationship between a patient and a healthcare provider is preserved, and I can assure you that it's preserved in El Hospital de la Familia. I think it's also becoming a very important model in Mexico, is my understanding. But I hope that as it grows, it doesn't lose, the personal touch and its core mission that has been so uniquely exemplified by El Hospital de la Familia in Juarez. So, again, with an individual like Guadalupe de la Vega, I'm not concerned about losing its core values.